Hi everyone, welcome to Drona Institute of Ayurvedic Studies. I am Dr Drishya H Bhat. Today we will be discussing the first 20 questions of AIAPGET 2025 question paper. I hope this video is going to help you understand the pattern, important topics, and how to approach the similar questions in your upcoming exams. So let's get started. Question number 1. Krishna Bhangurada is the doctrine of which philosopher? Option 1 Shankaracharya, option 2 Buddha, option 3 Kapila, and option 4 Gautama. This is a question from Padartha Vijnana Darshana portion and it is a direct question. Krishna Bhangurada is the Vada accepted by Buddha philosophy. So the right answer is option 2. While looking into other options, Shankaracharya accepted Vivartavada or Mayavada. Kapilacharya accepted many Vadas including Satkaryavada, Parinamavada, Karyakaranavada, Prakriti Purushavada, etc. Gautama Acharya accepted Arambhavada or Asatkaryavada and also the most important one Pidharapakavada. Buddhas not only accepted Kshanabhanguravada but also Shunyavada, Swabhavuparamavada, etc. Here the right answer is option 2. Going to next question. Question number 2 match list 1 with list 2. List 1 Snigdha, Yukti, Sugha, Gandha. List 2 Buddhyadiguna, Gurvadiguna, Shabdadiguna, Paradiguna. We had to identify the guna and its corresponding sub-classification. Snigdha, we know that it is a Gurvadiguna. Yukti is a Paradiguna. Sugha is an Atma Guna or Buddhyadi Guna. Gandha is a Vishesha Guna or Shabdadi Guna. The only option which satisfies this is option 2, A2, B4, C1 and D3. If we know Snigdha is a Gurvadi Guna, then we can exclude option 4. If we know Yukti is a Paradi Guna, then we can exclude 3 also. If we know Sukha is an Atma Guna or Buddhyadi Guna, then we can easily conclude the answer option 2. I think it's clear. Now, moving to question number 3. Which combination Sandhi is in word Hridyaushadham? Option 1 Vriddhi Sandhi, option 2 Yana Sandhi, option 3 Ayadi Sandhi and option 4 Guna Sandhi. This is a Sanskrit question. The first step here is splitting of the word. Hridyaushadham can be splitted into Hridi plus Aushadham. E plus Au comes as Ya. Hridyaushadham, Ya. So, which is this Sandhi? It is Yana Sandhi. I know this seems a bit complicated to some of you, but it's very easy if you got that idea. So, try to tackle it. Going to next one. Question number 4. According to Sushruta, consider 2 statements as given below. Statement 1, Ojasa is a Sara of Shukra. Statement 2, Sandhi Vishlesha is the feature of Ojakshaya. In the light of the above statements, choose the most appropriate answer from the options given below. Option 1, both statements are correct. Option 2, both statements are incorrect. Option 3, statement 1 is correct but statement 2 is incorrect. Option 4, statement 1 is incorrect but statement 2 is correct. Looking into the statements, the first statement, Ojas is a Sara of Shukra according to Sushruta. We know while explaining Ojas, Sushruta Acharya tells as Rasadinam Shukrandanam Dhatunam Yat Param Tejas Tat Khalu Ojaha. Hence it is clear that Ojas is not the Sara of Shukra only, it is the essence of all the 7 dhatus. So according to Sushruta, Ojas is not the Sara of Shukra only. So the first statement is wrong. But here, according to Ashtanga Sangraha, Ojasa is the Sara of Shukra. In Ashtanga Sangraha Sharirasthana 6th chapter, it is said that Shukrasya Saram Ojaha. So statement 1 is wrong according to Sushruta. In statement 2, Sandhi Vishlesha is the feature of Ojakshaya. According to Sushruta, what is the shloka for Ojakshaya? Murcha Mamsakshayo Moha Pralapo Maranamiti Chakshaye. So, Sandhi Vishlesha is not a feature of Ojakshaya. It is a feature of Ojo Visramsa. Sandhi Vishlesha is a feature of Ojo Visramsa, not Ojakshaya. So statement 2 is also incorrect. So the right answer is option 2. Both statement 1 and statement 2 are incorrect. I think it's clear. Now moving on to question number 5. According to Sushruta, Dhairyam is the function of which one of the following dhatu? Option 1 Mamsa, option 2 Asthi, option 3 Majja, and option 4 Shukra. Again a question from Sushruta Sutra, chapter 15, where the Acharya explains the functions of each dhatu. Dhairya is included as a function of Shukra dhatu. Not only Dhairya, Chyavanam, Preeti, Harsham, etc. also comes as the function of Shukra dhatu. So it is important to study the functions of all dhatus, especially according to Sushruta. Here the right answer is option 4. Now question number 6. Match list 1 with list 2 according to Sushruta, types of Vata and its properties. List 1 Vyana Vata, Udana Vata, Samana Vata, Apana Vata. List 2 Udvahana, Dharana, Praspandana, Viveka. Choose the correct answer from the options given below. Again a question from Sushruta Sutra, chapter 15, where the Acharya explains the karmas of each Vata. Vyana has a function of Praspandana, Udana, Udvahana, Samana, Viveka, and Apana, Dharana. The only option which satisfies this is option 4, A3, B1, C4 and D2. If we know the function of Vyana Vata is Praspandana, then we can exclude both options 2 and 3. And if we know Udana has the function of Udvahana, then we can definitely conclude the option 4 as the correct answer. Now, the next question, question number 7. How many types of Nidra has been described by Ashtanga Sangraha? Option 1 3, option 2 1, option 3 6 and option 4 7. According to Ashtanga Sangraha, Ashtanga Hridaya and Charaga, there are 7 types of Nidra. Swabhaviki, Vaikariki, Agni Mandyaja, Sharira Shramaja, Manashramaja, Ratri Swabhavaja and Vyadhyanvartini. But according to Sushruta, there are only 3 types of Nidra, Swabhaviki, Vaikariki and Agantuki. Here, according to Ashtanga Sangraha, there are 7 types of Nidra, so the right answer is option 4. Question number 8. Which bhava is responsible for Indriya Prasada? Option 1 Rasaja Bhava, option 2 Satmeja Bhava, option 3 Sattvaja Bhava and option 4 Madrija Bhava. This is a question from Charagam Sharira, chapter 3, which explains the characters of Shad Bhavas of Garbha. It is important to study the characters of each bhava. Here, Indriya Prasada is a Satmeja Bhava. The right answer is option 2. It is important to study. Coming to next question, question number 9. Which of the following is not a content of femoral sheath? Option 1 femoral artery, option 2 femoral nerve, option 3 femoral vein and option 4 femoral canal. Femoral sheath is a funnel-shaped facial structure just below the inguinal ligament in the anterior thigh. It encloses the vascular structures including femoral artery, femoral vein and the lymphatics of femoral canal. So, the femoral nerve which does not comes as a content of femoral sheath. The right answer is option 2. Moving on to next question. Question number 10. Sushruta has mentioned Kala in this order. Purishadhara Kala, Shleshmadhara Kala, Pittadhara Kala, Mamsadhara Kala, Raktadhara Kala. Choose the correct answer from the option given below. We know that according to Sushruta there are 7 Kalas. We should know it in right order. The first Kala is Mamsadhara Kala, below that Raktadhara Kala, and then Medodhara, and then Shleshmadhara, then Purishadhara, Pittadhara and Shukradhara. Here, the right option is option 1, D, E, B, A, C. we know the first kala is Mamsadhara kala, then we can definitely conclude the answer option 1. I think it's clear. Moving on to question number 11. Which of the following marma are kalantara pranahara? Lohitaksha, Brihati, Amsabhalaka, Katika Taruna, Guda. Choose the correct answer from the options given below. Lohitaksha is a Vaikalyakara marma. Brihati is a Kalantara Pranahara marma. Amsabhalaka is again a Vaikalyakara marma. Katika Taruna is a Kalantara Pranahara marma. And Guda is a Sadhi Pranahara marma. So here Brihati and Katika Taruna are Kalantara Pranahara marmas. So the right answer is option 4, B, D only. Now question number 12. According to Ashtanga Hridaya, in which of the following disease sleep is prohibited during night time? Option 1, indigestion. Option 2, throat disease. Option 3, diarrhea. Option 4, abdominal pain. In Ashtanga Hridaya Sutra Sthana chapter 7, while describing about Nidra, it is said that sleep is completely contraindicated in Visharogas and Kandharogas. So, here throat disease can be considered as Kandharoga. So, the right answer is option 2. Indigestion, which may be considered as Ajirna, diarrhea as Atisara and abdominal pain as Shulapidita. In all these three conditions, sleep is indicated even in daytime. So, the only disease in the option wherein the Nidra is prohibited during night is throat disease. The right answer is option 2. Now coming to question number 13. The Lekhana Anjuna is prepared from which of the following type of drugs? Option 1, drugs having bitter taste and hot potency. Option 2, drugs having sweet taste and cold potency. Option 3, drugs having astringent, sour and salt taste. Option 4, drugs having pungent, bitter and astringent taste. Here, the Acharya is not specified. So, in Ashtanga Hridaya Sutra Sthana, it is said that Lekhana Anjana should be prepared with drugs having rasas except Tikta and Madhura. Except Tikta and Madhura. So, option 3 were Kashaya, Amla, Lavana Rasa can be taken as correct answer according to Ashtanga Hridaya. But according to Sushruta, in Uttara Tantra, it is described that Lekhana Anjana can be prepared with all drugs except the rasa of Madhura. So, in option 4, Tikta, Kashaya, Kadu, rasas can be used. So, option 4 is right according to Sushruta. And hence, both 3 and 4 options are right as the Acharya is not mentioned here. I think it's clear. Now coming to question number 14. Given below are two statements as per Charaka Samhita. Statement 1. Nidra Baladihani is mentioned as one of the Lakshana of Vamana Atiyoga. Statement 2. Nidra Bala Abhava is mentioned as one of the Lakshana of Virechana Atiyoga. In the light of the above statements, choose the most appropriate answer from the options given below. Option 1, both statements are correct. Option 2, both statements are incorrect. Option 3, statement 1 is correct but statement 2 is incorrect. Option 4, statement 1 is incorrect but statement 2 is correct. While looking into statements, in statement 1, Nidra Baladihani is mentioned as one of the Lakshana of Vamana Atiyoga. In Charaka Samhita Siddhisthana chapter 1, Samyak, Ati and Ayoga of all Panchakarmas has been explained. In Vamana Atiyoga, it is said that Trinmoha Murcha Nidra Baladihani Vamane Aticha Syat. So, Nidra Baladihani is a Lakshana of Vamana Atiyoga. In statement 2, Nidra Bala Abhava is mentioned as one of the Lakshana of Virechana Atiyoga. In Virechana Atiyoga, it is said that Nidra Bala Abhava Tama Pravesha Sa Unmada Hikkascha Virechite Ati. So, Nidra Bala Abhava is mentioned as a Lakshana of Virechana Atiyoga. So, here both options are right. Hence, the right option is option 1. Both statement 1 and statement 2 are correct. Next question. Question number 15. Botanical name of herb Nidigdhika is Option 1 Curcuma longa. Option 2 Curcuma angustifolia. Option 3 Solanum surratens. Option 4 Solanum nigrum. Nidigdhiga is the synonym of the drug Kandhakari. We know that Kandhakari is a drug in Solanaceae family. Curcuma longa is Haridra in Zingiberaceae family. Curcuma angustifolia is Tavaksheri or arrowroot, which is also in Zingiberaceae family. Solanum nigrum is Brihati, not Kandhakari. Solanum surratens or Solanum xanthocarpum is Kandhakari or Nidigdhiga. So the right answer is option 3. Now moving on to question number 16. Match list 1 with list 2. List 1 Tila, Japa, Padmaka, Gokshura. List 2 Malvaceae, Zygophyllaceae, Rosaceae, Pedalaceae. Choose the correct answer from the options given below. We have to identify the drug and the family in which it is included. Tila, which is Sesamum indicum, comes in Pedalaceae family. Japa, which is Hibiscus rosa sinensis, comes in Malvaceae family. Padmaka, which is Prunus ceresoides, comes in Rosaceae family. Gokshura, which is Tribulus terrestris, is in Zygophyllaceae family. So the only option which satisfies is option 2, A4, B1, C3 and D2. If we know Tila is in Pedalaceae family, then from that itself we can definitely conclude the answer option 2. Moving to next question, question number 17. Rasai Rasau Tulya Bhalaha is described for which of the following Dravya Gada Padartha by Ashtanga Sangraha? Option 1 Karma, Option 2 Guna, Option 3 Virya and Option 4 Vipaka. In Ashtanga Sangraha Sutra Sthana, 17th chapter, Dravyadi Vijnaniya, it is said that Rasai Rasau Tulya Bhalaha in Vipaka. That means the Bhala is same as that of Rasa for Vipaka. Hence, the right answer is option 4, Vipaka. Question number 18. A patient comes to an OPD with complaints of diarrhea and indigested food particles and mucus. He has diagnosed with Apakuatisara. Which action is required to treat the condition? Option 1 Grahi, Option 2 Stambhana, Option 3 Sandhaniya and Option 4 Purisha Virajaniya. This can be considered as an application level question. In the karmas, various karmas explained by Sharangadhara Acharya. It is said that the condition is Apakuatisara. So we have two hints. The karma we select should control the Atisara. At the same time, it should digest the indigested food particles. So definitely we can exclude option 3 and option 4, where Sandhaniya, which means healing action or union promotion action, which have nothing to do in controlling the Atisara. In Purisha Virajaniya, which means improves or normalize the color of stool, can also be excluded. Coming to option 1 and option 2, Grahi and Stambhana, both controls the Atisara. Now let's check which digests the indigested matters. Grahi, which is Deepanam Pachanam Yatsyad Ushnatva Dravashoshakam. Grahi does the action of Pachana, that means digestion of undigested matters. Whereas Stambhana does not digest the matters, at the same time it increases the Vata dosha. So it is clear that the right answer is option 1 Grahi, Deepanam Pachanam Yatsyad Ushnatva Dravashoshakam. I think it's clear. Question number 19. Which of the following is an example of phase 2 biotransformation reactions? Option 1 oxidation, Option 2 methylation, Option 3 reduction and Option 4 hydrolysis. Biotransformation is the process by which body chemically modifies the drugs to make them more water soluble and easier to excrete through urine and bile. It has two phases. In phase 1, functionalization reactions occurs. They are mainly oxidation, reduction and hydrolysis. In phase 2, conjugation reactions are occurring. They are sulfation, acetylation, methylation, amino acid conjugation, etc. So, it is clear that the answer is option 2, methylation. All other reactions comes in first phase of biotransformation reactions. Now question number 20. Given below are two statements. Statement 1. Useful part of Nagakesara to treat Raktarsha is Strikesara, gynecium. Statement 2. As per Charaka, Nagakesara is administered along with Navanita and Sharkara in Raktarsha. In the light of the above statements, choose the most appropriate answer from the options given below. Option 1, both statements are correct. Option 2, both statements are incorrect. Option 3, statement 1 is correct but statement 2 is incorrect. Option 4, statement 1 is incorrect but statement 2 is correct. Coming to statements, in statement 1, useful part of Nagakesara to treat Raktarsha is gynecium or Strikesara. We know that the useful part of Nagakesara is stamens. Stamens are not gynecium but they are andrecium. So the first statement is false. In statement 2, as per Charaka, Nagakesara is administered along with Navanita and Sharkara in Raktarsha. In Charaka Samhita Chikitsa Sthana chapter 14, it is said that Kesara Navanita Sharkara Abhyasa is good in Raktarsha. So, conception of Nagakesara along with Navanita and Sharkara is good for Raktarsha. Hence, the statement 2 is correct. So, the right option is option 4. Statement 1 is incorrect, but statement 2 is correct. I think it's clear. That's all for the first part of our question paper discussion. I hope this helped you to understand the reasoning behind each answers. We will be discussing the remaining questions in the upcoming videos. Make sure you subscribe for more such videos. Stay tuned and thank you.